Hello, my name is Paige Becker, and I am doing a presentation on dysphagia. So, dysphagia is usually caused by another health condition, such as a stroke, that makes it difficult to swallow, and in some cases, it can make it impossible. This can be very serious because if you're not swallowing correctly, food can enter the airways and lungs, or more commonly known as aspiration. And in this photo, this is the flap in your throat. It's called the epiglottis. That just means that it's not closing properly right here, which is causing food to then go into your lungs as opposed to going in the pathway to your stomach. There are some common symptoms and signs of having dysphagia, and you can experience these symptoms and not be diagnosed with dysphagia as well. It's important to pay attention to these signs and visit your primary physician or your speech therapist if you have one and discuss any concerns that you can have. Significant weight loss is a big concern because it ultimately shows that the food you are putting into your mouth is going into the lungs and not the digestive system. Coughing and or gagging when swallowing is also a big sign, but it can involve having to swallow multiple times to get food to go down as well. Experiencing a stroke can cause a loss of sensation to occur, and that can happen in some people, not everybody. And so when this happens, you could be aspirating or having food go into your lungs and be completely unaware that it's happening. If you leave dysphagia untreated, it can cause really poor nutrition and even pneumonia. Lots of studies that I've looked at conclude that the average percentage of individuals that have dysphagia after a stroke lies between about 23 and 50%. After you experienced your stroke, or if you feel the need to get tested for dysphagia, the health professions around you, such as the nurses, occupational therapists, physical therapists, and any other health professions, are trained to look for the signs that are previously mentioned. They will give you small amounts of water and food in order to take caution when looking for signs as well. If these health professions believe that more testing should be done, there are a couple instrumental investigations that can be done. If you have any questions about these tests, please reach out to your speech therapist or any other therapist that can answer those questions for you. This is a video that's going to show what a normal swallow looks like in these instrumental investigations and what an abnormal swallow looks like. So as you can see, the fluid went down smoothly. It wasn't stopped. It didn't pool anywhere. And in this video, it pools right above that flap. And it's going down, and a lot of it went into the throat, the airway, as opposed to going into the stomach. So that's just an example of a type of video that they would look at when you are performing those studies. So if you end up having dysphagia, what can you do? Or if you don't want to go get diagnosed, these are some tips and tricks for you. So research has listed that these common solutions can be done at home. So first up is sitting up straight, which allows your esophagus or the tunnel or the way your food enters your stomach to widen and allow more space for food to go down. Taking small bites and sips and going slow will both help you focus and control what's in your mouth and control how much you swallow at a time. Using your tongue or fluids to clear your mouth of all food is important to make sure that you won't accidentally incorrectly swallow the food that's left behind. There's a couple different ways in research that I have read to move your head to help you close the gap in your throat if your body is not able to do so automatically. These include turning your head to your affected side after your stroke to your affected side and bringing your chin down to your chest, which is also called a chin tuck, when swallowing. These will both allow less space in between the flap and your airway, causing food to more easily go down your throat as opposed to the latter, which is not good. So another factor to consider when talking about swallowing is your overall oral hygiene. So there's naturally bacteria in your mouth, and not all of it's bad unless it's not cared for. Then it can lead to gum disease or tooth decay. So some medications that you've been prescribed can cause a decrease in saliva production, which can cause dry mouth. Saliva is necessary for washing food down and keeping your mouth clean from any extra food that may get stuck in your mouth while eating. Having diabetes or an HIV or AIDS diagnosis can also lower the body's resistance to infection, making it even more important to practice good oral hygiene. Some studies have found that the bacteria in gum disease can travel to your heart and cause heart disease or clogged arteries. And most importantly, it can make eating more enjoyable. You're able to taste the food more. You're able to feel where it is in your mouth and just enjoy the sensation of eating as opposed to just doing a voluntary action of eating. Using a fluoride toothpaste, such as these listed here, twice a day will work to prevent gum disease. If you look at any toothpaste tube in the grocery store or any other pharmacy, it should say fluoride toothpaste on it, so that way you'll know to get that right one. Flossing regularly to clean in between your teeth will help lower your bacteria levels as well. You can talk with your dentist about any floss sticks to use if you need an alternative to the strong floss. Attending your regular 6-month checkups with your dentist are also very important when keeping up with your oral hygiene. They will remove any unwanted plaque or bacteria from your teeth. If you have a dry mouth from medications, as I mentioned before, you're at risk for tooth decay. So it's important to keep your dentist up to date about the medications you take because they will know which ones dry your mouth out. If you are at risk, the dentist or dental hygienist can administer a fluoride treatment to strengthen the enamel on your teeth. This will ultimately make your gums less susceptible to bacteria. Lastly, chewing tobacco and smoking will damage your gums, so refrain from engaging in doing those. One way to improve your mealtime is to practice something called mindful eating. In doing this, you focus on more than just the food in front of you. You think about how the meal was prepared, who prepared it, and use your senses when engaging with the food. You'll notice how the food smells, looks, tastes, and feels in your body. You're able to feel and listen to your body in between bites that tells you when you're done eating or at least 80% full. If you were practicing mindless eating or distracted eating, which we'll talk about next, it can lead to anxiety, overeating, and weight gain. So how can you practice mindful eating? Mindless or distracted eating is so common nowadays since we tend to constantly scroll on our phones or stress about returning a text message. It's also common for some people to watch TV when they're eating. Doing these things cause distracted eating and don't allow you to focus on your food and how full you're feeling. Sitting with friends and families while eating have been proven to be beneficial for meal times, but talking on the phone is much different. It's better if you hold on to the phone calls until after you've finished eating. Same goes for watching TV or scrolling on your phone. Just in general, it's also distracting you from focusing on your meal. Skipping meals can cause you to feel more hungry when the next meal comes around and cause you to overeat and not listen to how your body feels. And you want to eat slowly to avoid overeating. That way you're able to listen to how your stomach feels after each bite that you take. And that is my presentation on dysphagia. And these are my resources. Thank you so much.